think we have a quorum, so we can start the Warren County Salary Board meeting, 1 p.m. Stand for the pledge, please. I pledge allegiance to the flag of the United States of America and to the republic for which it stands, one nation, under God, indivisible, with liberty and justice for all. Announcement that this meeting is going to be recorded. I, after review, get a motion or to review the minutes and ask if there's any modifications. If not, can someone make a motion to approve them?
Motion to approve the minutes is presented.
Okay.
Second.
All right. Any discussion? All those in favor, signify by saying aye.
Aye.
Okay. It looks like we have two old items, not new items, on the agenda. The first is bonus for law clerk on 2022. You'll see the paper there, judicial law clerk position with a salary and bonus amount. I believe, as Pam refreshed my memory, there was a recommendation to give the whole bonus amount, even though some of it was in 21 and some of it was in 22.
What we did is we approved 21 with the whatever requisite time taken out already, but it was the same position that hasn't been filled. It is thankfully filled at this point,
Right.
as of April 1st.
The only change, I just want to make note, is if somebody looks at my old calculation to this calculation, the bi-weekly amount that I used is different, and that's because all non-union people got a bit of an increase. So I used the new 2022 rate to calculate this. So if you're looking at what I did before versus now, it's going to be just a little bit of a difference.
Okay, all right. So that's in April 1st of 2022. So this is
Yes.
from January 1 of 2022 through the end of March.
Yep. So there were 7 payrolls. It came out to $12,887. Can't talk today. 49 cents. We always cut that in half, so the bonus figure would be $6,443.75.
Okay. So do I have a motion to approve this bonus amount of $6,443.75?
So moved.
Second.
Second, okay. Any discussion?
So this is again, using the same formula we've used previously when we have staff like in a department that are gone for an extended period of time and have a hard time refilling the position, and the other folks have to take up a lot more work. So we've done this before in other cases, so it's not.
It's the same formula that we've used in the past, and we're just approving the 2022. Okay, I have a motion and a second. Discussion, all those in favor signify by saying aye.
Aye.
Aye. Opposed? Nay?
Nay.
Okay. Motion carries.
Thank you. I'm pleased with the new hire was actually a law clerk for somebody in Cumberland County and needed to come closer to home, so it worked out for us now that we have to. So it's
Okay. And then another old item on the agenda is Forest Warren Human Services salary increases. I don't know how this, well, a couple things. One, it seems like there's a lot of sweeping changes that I haven't got a lot of opportunity to review, to be honest, as a voting member. And before I want to put this out for vote, my preference would be to go back and just review in detail kind of what I saw here from the director, as well as get some insight from HR as to how this compares. So I would request, or I guess I can do this, for this particular meeting, table that item on the agenda until the next meeting, and I would like to have the whole group get some additional information background based on what we've seen here. So,
Since we're on this here, do you want her to
would be just fine.
Should we start with the first one from last month, that's
The IDs.
the IT positions? Okay. So, the Office of Developmental Programs, through ARPA funding, gave our administrative entity office an additional $52,000. I believe you have, or a copy, of the letter stating that we received the $52,000. $50,000 of it is specific to administrative staffing initiative. An email was submitted stating the 3 staff, which would be Tammy Shippey as the program specialist, 2, or the director, and we have 2 program specialists, 1. John Kale and Stacey Lane. The email shows all of the new requirements for increase. Some of them are new, some of them are more in depth. Who is doing what job? It's a 2-page email. The funding of the $52,000, I asked for an increase of $3,000 for each person. The $50,000 is guaranteed each year for up to March 31st of 2024. After that, the state has said, if we have the funding, we will continue the administrative funding. I spoke with our fiscal department, and should that administrative funding through the state not be available, our fiscal department has said, yes, we can continue to fund this. We have the additional base funding through our department that would be able to supplement their wage increase. At $3,000 a piece, $2,700 of that would come through state and federal funding. $300 each, or $900 total, would be the county match for these 3 individuals. $900 annually would be county match. Also, that $52,000 in that letter, $2,000 of it was Family Driven Support Services Initiative. That is a service that has nothing to do with administrative responsibilities for these 3 individuals. That is specific to services for individuals. I can go over the services, the administrative responsibilities in this email that I have that Commissioner Eggleston sent out, if you would want me to, or you can read it.
Yeah, why don't you, if I can get,
Sure.
I personally, I don't know if anybody else in the salary board wants a copy, but that would be a really good idea.
I forwarded it. Yeah, it's not gonna be.
It's forwarded, you have it.
Got it.
Okay, so the administrative entity is responsible for conducting incident management regarding certified investigations. The incident management bulletin requires investigations around abuse, neglect, if there's emergency personnel, hospitalizations, fires. There's quite a laundry list in the bulletin. Some of these require the certified investigation. We just had an individual pass away, her obituary is in the paper today. We have to investigate that passing. The investigations per this new bulletin have increased in intensity. It's no longer a 2-hour investigation. They are now running between 8 and 10 hours per investigation. That is a significant increase of the time that our certified investigators spend on those investigations. So if you look, when you look at the email, fiscal year 1920 there were 7, 2021 there were 7. As of our fiscal year, which will end June 30th, we are at 9, and we have another one that we're in process of, actually 2 we're in process of doing now. The range of what is required to be investigated has also expanded. So not only the depth of the investigation, but also what has to be investigated has increased. That's investigations. Each of these investigations then has an administrative review. A team has been put together. Tammy, John, and Stacy are all part of that investigation review. That takes time, energy out of other responsibilities. There was a review process prior to this, but with the increase in their responsibilities, it now takes more time. Provider risk assessments is something that is relatively newer to our responsibilities with the administrative entity. There's actually a tool that has been put out that we are not responsible for specifically because we do not have home offices located specifically in Warren for our providers. Barbara National Institute is Erie, Lifestyle Support Services is Cambria, Lakeshore Community Services is Erie, so home offices aren't here. However, because they're in our county, we are still required to participate in that provider monitoring role. So we coordinate with the group homes, we coordinate with other providers like Barber National Institute and complete these risk profiles. It's an increase in responsibilities in new. Our intakes, Stacy Lannon is our primary intake person, Tammy is the backup. We have now added autism, which has been a new eligibility criteria within the last couple of years, and we are now accepting medically complex conditions, very specific criteria. We are also, the eligibility requirements as far as what tool is allowed has changed. We cannot just accept any tool. We are lucky that John Kale has a Master's of Education because he is able to conduct, it's called an ABOS. Please don't ask me what that stands for, I can get you that. But he completes the ABOS assessment, which is one of the 2 tools that is acceptable. So because of that, we are able to conduct that for many individuals that do not have that to meet eligibility criteria. So the referral process is taking a lot longer because of the new eligibility criteria. Waiver management, again, not a new process, something that we monitor. We receive waiver funding, which is the waiver from the federal government as far as services and who can have access to those waiver slots. There are initiatives, we have to monitor the initiatives to make sure the right person gets into the funding, and then how we manage those slots and who gets that funding. There's been massive rate changes, mass rate changes. I think they're massive because some of these rates get large numbers. However, lots of work associated with those mass rate changes and the computers, the service plans, the supports coordinators, lots of work around that. Increased monitoring requirements as far as services with our life sharing service. Health risk screening tool, which is a new tool that has been put out by the state. Our healthcare quality unit is working on completing those tools. We have the requirement of having the supports coordinators put that information in the service plan, and then the administrative entity has to review all that information, so it takes longer to review the service plans to ensure that the health risk screening tool is actually in the service plan. And then RMARS. I don't know what that stands for. We have a lot of letter soup, as you know. RMARS is a system that is a random moment in time study that is sent to our administrative entity and our supports coordination unit, and they have to, when the email comes up, what were you doing at this specific moment? This contributes to the amount of administrative funding we receive. We have to do corrective action, we have to do response plans, we have to participate. There are trainings around all of this funding. Those are the new requirements. Some of them are brand new, some of them are extended. Again, a lot of new responsibilities that our administrative entity, Stacy Lehman, John Kale, and Tammy Shippey are responsible for completing, which is why with this $50,000, I was looking to increase the positions within the confines of that funding.
A total of $9,000.
A total of $9,000 through 2024. If funding is not available after 2024, our fiscal department is able to supplement with which would be a $900 county total.
Does it make sense I mean, is it something else that you would want to carve out as a part-time position versus allocating or adding them to these 3 specific individuals?
So we looked at that, and a lot of counties have a lot more work, I guess, associated with that, and we contemplated hiring a new person. It's very difficult in the human services field right now to find people to fill positions. So to find a part-time person that would be able to work to do these, I don't know would be something that we would be able to fill, which is why when we sat down and looked, when Tammy and I sat down and looked to determine if this is something that we would be able to distribute amongst the 3 workers, the 3 positions, and it was felt that they could take on this work because some of it was already work they were accomplishing. So we did look at that, yes.
So these are new requirements ongoing.
Some of it's new, ongoing, some of it is expanded, ongoing.
Okay.
And Jeff sent that document.
Yes, it's an email,
We'll be good, yeah, that's good.
yes.
All right,
So help me understand, if you're gonna get 50,000 and you're gonna pay how much?
9,
This
3,000 for each.
at least, this says 5?
That's
At the
separate.
top.
That's
This
the
is-
top.
Oh, I'm sorry, I'm
referencing
sorry,
the
I'm sorry.
top.
Okay, I'm
This is
sorry.
the new.
I looked at the bottom, sorry, okay. So you're gonna use 9, what happens to the 41?
If we do not use it, it would most likely go back in our, reallocate it back to the state, or it could be pushed into our carryover funding.
Okay.
It depends on how the state wants to look at what that funding would be done.
There's a list of uses there, and so there has to be some work done on, you know, like if some of it was gonna be used for a contract or something, or.
Because it's ARPA funding, it's not our typical administrative funding. So I'm not sure how they would look at that, because some counties may be hiring, again, Allegheny County might have received $400,000 because their population is so much more. They may be able to use that additional funding. We cannot. 50,000 isn't enough to hire a full-time person. It's not enough work to hire a full-time person. We don't feel that it's enough to even hire. It could be enough to hire part-time, but I feel that it would be difficult. So they may take that money and give it to another county once they see what we are looking at, how we're looking at spending it.
Okay, so
Because it's ARPA.
So you got 50, you're gonna use 9, but the ARPA is not guaranteed, and you mentioned earlier that whatever funding you get will be able to cover this if the
Yes.
legislature doesn't cover it.
So this funding is ARPA, and it is guaranteed through March of 2024.
Okay.
After March of 2024, we have our regular administrative funding that we use, that we would be able to fund this with. Our allocated administrative funding, we do not necessarily use all of that.
All right, so you have a cushion, what you're saying,
Yes, yes.
to be able to cover this going forward.
If the state is not able to identify funding to cover it.
All right, now, so help me understand if it's federal, state, county, what would you say going forward would be that breakdown? If, let's,
I can't say, I don't know how, I don't have a copy of my allocation with me, so I don't know what percent is state, what percent is federal. I can get that for you
so,
if you're
but
interested.
I guess what I'm trying to, so if the state doesn't come forth with, to cover it,
Correct.
does that mean like federal is this much, state goes to nothing, and then the county goes up?
No, so our allocation, the letter we get that says this is your funding, is stable. What I'm saying is they would have to continue to fund this 50 after March of 2024, they would have to find new resources. That might not be available after 2024. We have a cushion, as you identified, to be able to continue this funding, and that's the state and federal. So that is a quote-unquote guarantee. It has been stable for years.
Because every year they negotiate a budget essentially with the state, and so like their administrative amount is like this, so they would say, we've had wage increases, so you have to cover this additional piece.
That is stable, and that is where, should we need it, after 24 it would come from. If the state is not able to increase their state budget to cover it.
Okay.
Yes.
all right, well, I don't have any questions right now. But I would like to just do a little bit of research, read what you have here, kind of coordinate with HR if any questions that I have, and then
Absolutely.
get back.
So I apologize, I shared the information with HR, and I didn't know that I also needed to share it with
That's
her.
okay,
So
that's
I
fine.
apologize
No, that's
for
fine.
not
That's fine.
sharing the rest of this, so, okay.
All right. Is there any other old items that are gonna come before the board here? Doesn't look like there's any on the agenda.
So, may I ask, so if we, all right, so when would we expect to revisit this?
May,
Next meeting, basically?
Yes, next week.
Okay.
Yeah.
And, all right, so that being said, when did all this work get implemented? When did they absorb the work?
So I would say within the last 3 to 4 months.
So basically roughly the first of the year.
I would say, yeah, it's been coming out slowly, different pieces here, different pieces there.
Some of it started last year.
Yeah,
Doesn't some of it though, it's just recategorizing?
Right,
So some of the old work isn't there anymore.
No, so like the certified investigation has always been there, but now they've outlined, it's a new process for that. It's now expanded, so none of the work has gone away.
The waiver, does this mean that people actually get served more timely? Because I've had kids that are in the dependency system that, you know, we're planning 2 years out and it still doesn't get approved in 2 years.
So the way the waiver funding is occurring is, the biggest initiative is the graduate initiative, and they have to stay in school till 21. If they do not meet that criteria, they do not get a waiver slot. And some of our dependency children are not meeting that criteria.
Yeah, we have one of the very severe medical issues, and you're aware of that.
I am aware of that one.
But I'm concerned that, you
Yes.
know,
So when waiver slots come out, and they typically come out with a budget, we either get the consolidated waiver, which is the highest. There's criteria, and we have to look at our waiting list and who's the most significant. I can tell you she's probably the top of our list. Okay, I'm thinking of a she. So,
and you know, you remember the he because he's been in placement the
he
longest.
has a consolidated waiver, I believe.
Not yet.
So is,
Well, in
We'll
any
talk.
event,
Okay.
as it relates to that,
That's-
it's still separately.
so waiver is a different subject.
That's federal
Yes.
funding, yes.
It's a
That's a
different-
different subject.
Okay, I mean, not to discount it, I'm just saying,
No.
it's not included in these positions.
Yeah,
It's been expanded.
They-
The waiver administration
they
funding.
administer it locally. Yeah, I mean, the waiver issue,
Yeah, I'm not
waivers
sure.
are like liquor licenses.
No, but I mean,
They're limited and everybody wants one.
Right,
And technically, there's a case to be made, they need to expand it, but that's a whole nother discussion.
right, it is. All right, so, nothing else on those
So I'll
items?
make a motion to adjourn.
Okay, second, okay, all those in favor?
Alright.
Aye, we'll discuss that.
Thank you.
that would be an interesting discussion.
Whether to adjourn or not?
Do you want to hear about the others?
I'm gonna read it and then can I just speak with you separately? That would be great.
Nobody decided to table.
That's okay.
No, we
I
do
think
what?
everybody-
Oh, I'm sorry, do we need a motion for that?
Well, technically, yes, but I think that was just the understanding of the group, so I
Yeah.
think it'll be fine.
Jeff seconded it.
So, Ronna, was there something you wanted to say about the other one?
I was under the impression that I was going to be able to talk about the new ones while we were all here, but that's okay.
We should-
When's the next meeting? 'Cause
May.
What we should do
Yeah,
is,
because you skipped a meeting for this, right? Was
that
that
was the last meeting, but I'm having surgery in May and I don't know if I'm going to be available for the next meeting, and that's a concern.
May 11th.
I am working.
so between now and then, we should schedule a meeting, you can come in and discuss it with everybody.
I think that'd be great. I think that'd be great. And I put on the agenda for the next meeting.
Yeah, if you have any questions, don't hesitate to email me.
Just a quick question before you leave. The funding for the three at the bottom comes from,
It's all money that